Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Spinal shock is a serious medical condition that affects the nervous system. It is a complex phenomenon that requires immediate medical attention and understanding. It occurs after a spinal cord injury, which can result from various traumatic events such as car accidents, falls, or sports injuries. The spinal cord carries signals between the brain and the rest of the body, acting as a crucial communication highway. When the spinal cord is injured, these signals are disrupted, leading to significant changes in bodily functions. This disruption leads to a temporary loss of function below the injury level, which can be quite alarming for patients and their families. This can include loss of movement, sensation, and reflexes, making it difficult for the patient to perform everyday activities. It's important to remember that spinal shock is different from a spinal cord injury. While both are serious, spinal shock is a temporary condition. Spinal shock is a temporary reaction to the injury, and with proper care, patients can see improvements over time. It's a period of altered activity in the spinal cord, where the body is trying to adapt to the injury. The duration of spinal shock varies from person to person, depending on the severity of the injury and the individual's overall health. Understanding spinal shock is crucial for early intervention, as timely medical care can make a significant difference. Prompt treatment can improve long-term outcomes for patients, helping them regain as much function as possible. Early care also helps to prevent further complications, ensuring a better quality of life for those affected by spinal shock. The most common cause of spinal shock is trauma to the spinal cord. This trauma can be sudden and severe, leading to immediate and significant impacts on the body. This trauma can occur in various ways, each with its own set of circumstances and risks. Car accidents, falls from significant heights, and sports injuries are common culprits. These incidents often involve high-impact forces that can severely damage the spinal cord. Direct blows to the spine can also lead to spinal shock. Gunshot wounds, which can cause extensive damage, and stabbings are examples of such injuries. These violent acts can penetrate the spinal cord, leading to immediate and severe consequences. Any event that damages the spinal cord can trigger this condition. The body's response to such trauma is often swift and dramatic. The severity of the spinal cord injury determines the extent of spinal shock. More severe injuries result in more profound and lasting effects. A complete spinal cord injury results in total loss of function below the injury level. This can lead to permanent paralysis and significant lifestyle changes. An incomplete injury may cause partial loss of function, allowing for some movement and sensation below the injury site. Other factors can also increase the risk of spinal shock. These include underlying health conditions and lifestyle choices. These include pre-existing spinal conditions, like spinal stenosis, which can weaken the spine and make it more vulnerable to injury. Age is also a factor, as older adults are more susceptible. Their bones and spinal structures may be more fragile, increasing the risk of spinal shock from even minor trauma. Recognizing the signs and symptoms of spinal shock is vital for ensuring prompt and effective treatment. Early detection allows for timely medical intervention, which can significantly improve patient outcomes. The primary symptom is a loss of muscle function below the injury level, which can be quite alarming for the patient. This can manifest as paralysis or weakness in the limbs, making movement difficult or impossible. Patients may also experience a loss of sensation, which can be distressing and confusing. This includes numbness, tingling, or a complete absence of feeling, affecting the patient's ability to sense touch. Loss of reflexes is another hallmark of spinal shock, indicating a disruption in the nervous system. Doctors test for this by tapping on tendons to check for the usual reflex responses. Absence of the usual reflex response indicates a problem, necessitating further medical evaluation. Other symptoms can include difficulty breathing, low blood pressure, and loss of bowel and bladder control, which require immediate attention. If you suspect spinal shock, seek immediate medical attention to ensure the best possible care and recovery. Section 4. Diagnosis and Assessment. Diagnosing spinal shock begins with a physical examination. Doctors assess the patient's neurological function, checking for movement, sensation, and reflexes. Imaging tests are crucial for confirming the diagnosis and assessing the extent of the injury. X-rays can reveal fractures or dislocations of the spine. Magnetic resonance imaging, or MRI, provides detailed images of the spinal cord and surrounding tissues. This helps doctors identify the precise location and severity of the injury. Other tests, such as nerve conduction studies and electromyography, or EMG, may be conducted. These tests evaluate the electrical activity of nerves and muscles. Section 5. Treatment and rehabilitation. There is no cure for spinal shock, but treatment focuses on managing the symptoms and promoting recovery. Immediate treatment often involves immobilizing the spine to prevent further injury. Medications may be administered to manage pain, reduce inflammation, and prevent complications. These might include corticosteroids, pain relievers, and muscle relaxants. Rehabilitation is a crucial aspect of treatment. It aims to help patients regain as much function as possible. Physical therapy focuses on improving strength, flexibility, and mobility. Occupational therapy helps patients adapt to daily activities and regain independence. Psychotherapy provides emotional support and coping strategies. UMCC, your ultimate medical consultant connectors.